How much does it really take to recover from dimpleplasty?
Thank you for your question. You've submitted a question without a photo, and you're asking is how long does it take to recover from dimpleplasty? Well, I can certainly give you some guidance on how I speak to my patients about this procedure. A little bit of background, I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and the subject of dimpleplasty has actually been an area of focus in our practice, and to the point where we've actually been recognized by certain news media and other outlets in the media as being an authority in the world of creating dimples. And it's a kind of a curious development in my practice. People do come from around the world for me to create dimples, and I'll explain to you a little bit on how I approach dimpleplasty and what I tell my patients. The timing of this question is interesting. It's in this past week I've done about 7 dimple procedures, which is unusually higher than typical, which means that the popularity of getting dimples continues to grow. Anyway, the point is that the concept is very important to understand, and that there are different ways to do this procedure. The concept of dimples or cheek dimples has to do with the natural opening that occurs for people who they're born with dimples in a muscle called the buccinator muscle. And so when they smile, there's this nice dimpling of the cheek, which many people find to be desirable. Well, when we create something like this surgically, essentially we're creating a connection from that muscle through the inside of the mouth to create a connection between the muscle and the skin of the cheek. When the muscle contracts or is activated, such as when smiling, the cheek pulls in and you get this nice dimple shape. So now what I explain to my patients is, for my procedure, the way I do it, I'd say that initially you have to understand that you are going to have a dimple in the skin that's going to be present all the time. So you're going to always have this indentation for the next couple of months. The point of stating that is that just to be prepared, that in order for the dimple to hold, so that when the person smiles and it occurs more naturally where the skin indents, you have to do this in a way that's relatively strong and aggressive in order to make sure that connection forms. Now, interestingly, most people who I've done this for have absolutely no issue with that concern, that having a dimple, even when they're not smiling, in no way interferes with their social or professional life, which I find pretty interesting. That being said, what I tell my patients is since we're working from the inside of the mouth, you have to take some basic precautions about keeping the mouth clean and avoiding hot liquids after the procedure. Generally speaking, we've had patients go back to work the next day after a dimple procedure, because essentially there's no external incision. Everything is done from the inside of the mouth, and therefore there is no stitches or anything on the outside. There's just the obvious indentation of the dimple. Now, the progression of healing, what happens over the several months is the dimple starts to soften a little bit, and so that eventually it only occurs when smiling. And there can be kind of a subtle indentation there. And you see this in people who have natural dimples, particularly if they're relatively lean. So I would say that in terms of work, depending on what you do and being aware not so much of the relative healing process that's so critical for safety, but really also about the social appearance of having the dimple present even when not smiling, is an adjustment that you have to think about in terms of your own work life and whether people would notice around you. So I would say that in a perfect situation, maybe give yourself a few days. Otherwise, like many of our patients, you can go back the next day. Now, there are different ways to do this procedure, so the doctor you choose to have this procedure with will guide you as to what generally they feel works for them. So this is how basically I advise my patients in my practice. So I hope that was helpful. I wish you the best of luck, and thank you for your question.